Welcome to ZOOMERTIMES TV. And here's your host, Anita Finley.
Well, this is a special treat. For many months now, well, anyway, let me start off. I'm Anita Finley, and this is ZOOMERTIMES, and we're our ZOOMERTIMES TV presentation. And for many months, we've had this beautiful, very intelligent woman, Cynthia Meacham, who has been telling us all about Medicare, HMOs, Advantage plans, and anything to do with that. And I have been talking, though, with the man who is in charge of this whole huge company across the country, Joe Battaglio, and I have not had him on the show, but this is a big surprise today. We now have them side by side, and I'm not even going to say anything because the two of them are so smart. I'm just going to start off with what's going on in this upcoming month. Let's start with you, Joe. This is a very big time for people who want to get on Medicare HMOs, isn't it?
Absolutely. You know, it's a season of changes, as we say. And the idea is AEP season, annual enrollment period. Millions and millions of seniors across the country know what that's all about. And because of the information that's out there, you know, we're inundated with information everywhere. It gets confusing, right? I mean, you look at one senior says one thing, another senior says another thing, and what do you do, right? So it gets very, very hard for the senior population. And you know what we do. We're out there to help them. And I mean, Cynthia, share about what the options are. I mean, there's so many different options, as you know, and share with the audience.
Yes, there are so many new plan changes this year. Formularies are getting updated. And it's really nice just for us to review your Medicare plan and make sure you're still in the most comprehensive, suitable, and affordable plan for you. Because there's all these new benefits, and as we've spoke before, the formulary changes every year, Anita. So we need to make sure that we're up to date and staying in the right plan for this coming year.
Excuse me, I'm going to ask you to explain what a formulary is. You know, people are listening and some of them have no idea what that is.
Yeah, so a formulary is the drug coverage on each different plan. And each different plan has different formularies. So sometimes a client could be paying, you know, they're broken down in tiers, tier 1, 2, 3, 4, 5. And sometimes companies are covering them at a much higher tier than what they could be. And they could, you know, talk with us and find out that their medication is being covered with another provider, another carrier at a much lower cost.
And you know, if I can share, Anita, you've had a Medicare health plan for years, right? If you look, have your prescriptions ever changed from one year to the next?
Oh, absolutely. They changes all the time.
Right, and that's what Cynthia's bringing out. It's always important to look at the formularies because they're always different, even with the same carrier. They might change from one year to the next, so that's why it's important to check out all the different carriers out there.
Absolutely.
Well, you know, Joe, one question I have for you, because you are a national company and you do have some wonderful representatives down here, especially, you know, Cynthia Meacham. But is this the same problem across the country?
As far as prescriptions?
Yeah.
It certainly is, yes. It's a national issue, we'll say. You know, prescriptions change. You know, you look at this country, we take a lot of prescriptions. I'm going to share some facts with you in a moment. But the idea is prescriptions is a major part of healthcare industry. And because of that, insurance companies sometimes can't absorb the cost and they pass it on to the consumer, which would be the folks. So, you know, it's important to look because although it's national, it does change differently for every state. So we need to look at that too, and that's how we can help the seniors.
So when people are down here, Cynthia, and they're really from up north and they come down here, so what do? I mean, does it change for them while they're here and then they go back up north?
No, it doesn't change for them. They're on the same plan, probably a PPO, so they're going back and forth. They're able to use it nationwide, and the formulary is going to stay the same whether you're in New York or down here in Florida.
I see. So it just, and I know you explain all this to them. The one thing about you that's been so clear is there isn't a question I can ask you that you don't have a very, very good answer for. And I have a lot of questions actually to ask you for, as a matter of fact. There's a whole, now as people are turning 65, there's a whole Medicare planning. When should they be calling you? And let me give that phone number out because I think it's important. 954-802-0738, correct?
That's perfect, Anita. That's my number.
Okay, so what happens is someone calls you and they're, I don't want to call them dumb, but they've just not had any experience. What happens?
Well, I sit down with them and I explain to them what original Medicare is, what that covers, and why they need additional coverage to cover in those gaps. Because original Medicare is gonna leave them with no cap, so they can be out tens of thousands of dollars. So it's so important for them to find a plan that's gonna cap their costs, whether that be a supplement, an advantage plan, that all depends on, you know, the clients. And that's why we're so great, is we're an unbiased resource for everybody turning 65.
So Joe, you have been doing this. How long have you been actually in this field?
Well, since Medicare, in other words, not when Medicare started, that was a while ago. But the idea is we started with this, Medicare Advantage plans first came out back in 2007, right, the way they are today. So our agency started then as far as for the Medicare. So since then, we've helped tens of thousands of people across the United States. So we're very proud of that.
Well, when people call and they have questions on Social Security, for example, or long-term care, what do you say to them, Cynthia?
Well, if they have questions on their Medicare, Social Security, you gotta call Social Security. Unfortunately, I don't have any of that information. But if they do want long-term care, Senior Services in North America covers everything. So we're able to help them out with all of their retirement needs.
And if I can share with you too, Anita, it's very important, as far as with Social Security, as Cynthia was mentioning, right? You know, that's protected health information. Of course, they would contact Social Security for that. But as far as on the other end, I think you were looking for is with Social Security, you know, this, do I take it now or do I delay, right? Because if you delay taking Social Security, you know, you get more, right? If you take it early, you get less. So we do help them as far as counseling with that, because at Senior Service North America, we're not that typical agency out there, right? We look at the total approach, and that's what's so different. You know, the total approach is not just Medicare. You know, that's wonderful, Anita, you have Medicare. But what about your Social Security plan? How is that working out for you? Because when a person turns 65, they're inundated with this information and they don't know how to decipher it. So we're here to help them as far as Social Security planning to the Medicare planning. You also mentioned about long-term care. You know, long-term care is such an integral part of the whole retirement planning phase, right? But a lot of folks, they overlook that, right? Because the agents that they work with, they're not versed in that. We are. So we take the total approach in looking at everything that's going to affect your lives in retirement. So it's not just Medicare. So checking out the right plan, what's right for you, what's suitable. You know, everybody wants the most comprehensive coverage and pay as little as possible. And that's what we're able to do because we represent all the carriers. Then you look at Social Security plan. We can help you with that. Do you delay? You know, are you making money now as far as employment? Do you need to go on to Social Security? Is Social Security going to be enough to live on? Should you stay working if that's available? So there's a lot of questions that we look at to help them plan. And then again, you have the long-term care plan, which leads into the total estate plan. You know, that's very important because that you're living 30 more years, we hope, 40 more years in retirement. We want to make sure it's all good for you. So we're proud of that. That's what we offer to all the Medicare beneficiaries also.
Well, let me just say that my son, who is 60, I think he's just 60 and his wife's 63, they asked me about long-term care and I did refer him to you because I do trust you. And I said, you got to call him. And I know they're probably busy, but they're going to be calling you because you do seem to know so much about so many things. And frankly, I admire you probably most for finding Cynthia. She is such a star.
Thank you.
She is. She's very
It is
talented in what
true.
she does. She's incredible.
I know, and she's so enthusiastic. And I mean, there isn't a question that you ask her. And as she says, if she doesn't know the answer, she's going to find it. No, she's
And
very
she means
good
it
about
too.
this.
She means it. Right?
Well, the big thing is, I notice a lot of new HMO Advantage plans coming on the market. So I once asked this to Cynthia, how do you keep up with all this, Cynthia?
We train, we meet with the regional sales managers, we go over everything, and we have a great system where I'm able to pull in all their information, and it actually tells me what is the most recommended plan for them per se that's going to save them the most money on their RX and their doctor co-pays and all that good stuff.
Yeah, it is confusing. You started off with that saying, and it is. And sometimes people do think they know and they tell their friends and they don't have it right. So you probably have to, Cynthia, in a nice way, explain to people, no, that's not quite right.
That's right.
So
Yeah, that's the way to do it. Let's face it. You have to, in other words, we really take pride, you know, the way Cynthia is, this is what we're all about. You know, we're real people, we're a real agency. And if you pick up the phone and call us, we answer our phone because, you know, you want to speak to a live agent. That's what we're all about.
oh, thank you. That's a very good thing. Do you know how many times, not only for what you do, I call and they're going to take your name and number. They don't call you back or they call you back a long time from. But people are not going to wait around. They're going to say, okay, next.
Yeah, exactly. Nobody answers their phone anymore, Anita. I don't know what it is. Nobody answers their phone. I
Let me
always
tell
do.
you,
So does Cynthia.
when I call Joe, you answer. When I call Cynthia, she answers it. I mean, or it says that she's on the other line, she'll call you right back, and she does.
She does, absolutely. I can attest to that, that's for sure.
Well, one thing we've been talking about is what the difference of HMOs, HMO Advantage, PPOs. That's because there are advantages in some of them and disadvantages in other. Maybe you ought to go over that, Cynthia.
So the advantages, it really depends on the client. Like we discussed before, the HMO is per the service area, which could be their county, the counties outside of them. With the PPO, they have a much bigger network. So depending if they travel, if they have a lot of doctors, a PPO gives you in-network and out-of-network benefits where an HMO does not. So it really depends on the client's specific needs to see which plan they're going to go into.
And if I can share too, also, when we're looking at the PPOs, you know, you look at the majority of plans, the statistics now are showing us, Anita, that more of the seniors now are migrating towards the PPOs. That's the latest statistics now. So when there are plans, when there's no PPO available, of course, they're going to go into HMO. But any areas in the country where there are PPOs, you find more seniors are migrating towards the PPOs. Now, as Cynthia was bringing out is, if you look at the PPOs, you can go to out-of-network facilities and doctors, but the idea is you're going to pay slightly higher. However, it's very advantageous because also some carriers, depending on the state. So let's say there might be ABC carrier in New York and ABC carrier in Florida. Since they have two networks, you can access their networks and they're still in network. So you don't have to worry about the out-of-network. So that's really nice too. So the HMOs, you know, you're restricted to networks. The PPOs, you're not, but you pay slightly higher, but at least you have more enhanced coverage. So that's nice, right? You know, you look at med subs. Med subs, you have to add the standalone Part Ds. A lot of people like the, I guess, the convenience of having a peace of mind, they call it, of having a med sub. But the idea is there are more people on Med Advantages today than Med subs. Now, that doesn't mean that one is better than the other. It's just a statistic. When you look at the enhanced benefits that the Medicare Advantage have now, it's incredible, right? I mean, what are some of the benefits they have?
Oh gosh, now they have all kinds of, they're coming out with a flex card in addition to their dental, vision, hearing. You can do acupuncture, chiropractic. Transportation. The list goes on. There's meal cards.
Yeah.
I mean, these benefits are so rich that it's almost hard to turn them down sometimes as a senior. You're not paying anything for them.
Right, and look at the some plans have it either where they give you back the Part B premium back.
Right.
The 148 you pay, they give that back to you. So, you know, they are very rich in their formularies, they're very rich in the benefits they give out. What I always stress, and Cynthia always stresses, is it's not about those extra benefits, it's about your doctor's hospice medicines. So you want to make sure they're included, you want to make sure that you're not paying high co-payments. Those extra benefits are wonderful, but you want to make sure your doctor's hospice medicines are covered. So that's important to look at. Absolutely. And that's what we do.
Well, let me ask you, it's probably a stupid question, but what does PPO stand for?
So preferred provider organization.
I didn't know that. Everyone
it.
just says that word.
Yeah.
Well, the other thing that I was curious about, and you said that, of course, you were from New York and Dan has family there. So if he is on an HMO Advantage here and he winds up in New York and he gets sick, his HMO Advantage may not take care of him. What does he do?
No, it does. If it's an emergency, it will cover that. So if it's an emergency, it will. And then you look at some plans, if it's not an emergency, again, There are certain plans that have, they call it travel rewards or passport programs, where you can utilize, if they're in a particular state, also, you can utilize those in-network procedures and facilities. But it depends on the
okay.
carrier. Yeah, it depends on the
I
carrier.
see.
And what we always do when Cynthia first looks at, and any of our agents look to, and when I'm speaking to somebody, they always ask, do you travel? You know, a lot of agents out there neglect to ask certain questions, and that's important. We have a suitability questionnaire, we call it, where we ask a series of questions, so there's nothing hidden. Everything is transparent and no surprises, because nobody likes surprises.
Yeah, that's good. Yeah, it's the questions, and because a lot of people don't know what questions to ask. So you ask the questions and then
We
they
ask
answer,
them.
and then you find out that what you thought maybe at the beginning of what you were going to suggest is not correct, right?
Absolutely.
Well, let's just talk about some of the other things to do with this. Let's say that someone has I did want to tell you something. I think there's one more positive aspect to the HMO Advantage. I've been working with a company called Join Papa. It's Papa Pals.
Yeah.
Yeah, I think they've just now come in to some of the big, to Aetna and Humana. Have you heard of them?
Yes, absolutely. And there's also Mama too. They got Papa and Mama.
Oh, really?
Yes, absolutely. Yes.
Okay.
So Mama comes and cleans your house, the one for the meal, so lots of great stuff. And again, you don't get that with the Medicare supplement plans, but again, maybe it's more appropriate for you to have the Medicare supplement. And that's again what we help you decide upon.
And so, and let's say this again, if you join an HMO Advantage, there's no cost to it, right? It's only in when you maybe have to go somewhere and you have to pay, but generally it's free. Is that correct?
Well, what you look at is that a lot of those plans, there are lots of zero premium plans that are out there. So what you look at is this, and very simple, you know, do you want to pay before you use the healthcare, AKA a Medicare supplement, or do you want to pay as you go via Medicare Advantage plans? So what you look at basically is a lot of folks examine, you know, it's all about dollars and cents. You know, do you go enough times during the course of the year to warrant spending thousands of dollars for a health insurance plan, also known as Medicare supplements? Or do you feel you rather pay as you go, right? And you know, statistics show us that more people have the Medicare Advantage than Medicare supplement plan. And again, I must stress, that's only a statistic. That doesn't mean what's right for somebody. You have to look at that. But the idea is, you know, looking at what people's needs are. Some people say, you know what? I don't want to spend the extra money. I'd rather keep the money in my pocket. Because I always tell people, simply write a letter to your Medicare supplement plan and tell them, I didn't use it, can I have some money back, right? Nobody ever gave the money back, right? They don't give the money back. So it's again, you have to look at what's appropriate for that person. But most importantly, we represent everything.
All right, and the other question that I've had asked, people have said, well, you know, I'd like to know who to call if I have a problem. Now, Cynthia is very sweet and she said, oh, they can call her. But when you're in an HMO, is there a person that is your particular salesperson?
No, absolutely. On the back of their card, it'll show member services and you can call a carrier directly. And I always say that to all the folks we work with, call them first. That's the first line. If you don't get anywhere, then you call us and we'll get the job done. But they're good at it. The member services team, they're really good at what they do for all the carriers.
Yeah, they're very well trained, depending, of course. And now we have, as I started telling you, there are some new HMO Advantage plans coming out. Some of them called us about advertising. And what do you think makes the difference? I mean, let's say there are 5 of them, 5 of the big ones. What really makes the difference in each one?
You go first.
Who has their doctors, their hospitals, and who's gonna cover their medicines at the best cost? That's how I would determine out of the 5, which one is correct for that client.
And you know what's funny too? What we do in here is we have a software program where you input all that information and it'll tell us which carrier makes sense. In other words, here's what I think you would want to do. You want to have a plan that covers all your doctors, all your hospitals, all your medicines, and you pay as little as possible every month. That's what everybody wants, right? So it's not hard. We know what everybody wants. It's finding the carrier, because not every carrier has every doctor. Not every carrier covers every medicine. Not every carrier has medicines covered at a certain cost that's affordable. There's so many differences, so many little things to look at, and that's what we're there to help.
Well, the other thing here in South Florida, we have 3 major counties. So you may have an HMO advantage, but it may not cover all those counties, or may not go up to, or,
Well-
a Stewart or some other place north.
Okay, so what you have to look at is with an HMO, again, the service area is a service area, right? Now, it doesn't mean you can access, if you have an HMO, you can access doctors that are in that network still, all right? But the idea, so I want to be clear about that. So it doesn't mean just because of an HMO, you have to use Dade County physicians. That's not true. You could use doctors in other counties too. That's their network. But you have to make sure it's in the particular plan's network. That's different, right? So that every plan has other plans, right? So the carrier might have 4 or 5 different plans. They might not use the same network for each plan. But if you have the same plans in different areas, I know it's a little confusing, just give us a call.
Yeah, that's right. And you see, just this one half an hour discussion with both of you who are really so smart, you can understand why people are confused, and there's so many answers. And I think that before, Cynthia did say that every year she has to have an education class on what's going on, and I can understand why.
Yeah, it's necessary, it really is.
Absolutely.
There's so many folks out there, you look at, they stay on certain plans, say 4 or 5 years, the same plan. And you get that a lot, Cynthia,
Oh,
right?
yes, absolutely. And sometimes their need changes,
Yeah.
but they haven't changed their Medicare policy yet. So they're paying the higher costs, they're not getting all these extra benefits. So they just get, complacent in what they're doing, and
They don't wanna change,
They
they
don't
don't
wanna
wanna change, it's hard sometimes, yeah. But that's the good
Well-
news, is that you can help them.
Right. My mother lived until about 2003, and she had Blue Cross, and she just loved Blue Cross. I mean, you couldn't talk to her about anything else. Blue Cross, that was it.
Right, absolutely.
But at
They
that
like the
time, I don't
name.
think there were very many else in here in Florida.
No. It's come a long way, They're
Right.
different, that's for
And,
sure.
and also Humana, at the time that I first knew them, they were local, they were not national.
No, they have a major presence in the state of Florida now, major presence.
Yeah, well, and then, a lot of people also thought that AARP is, and I don't want to go into certain companies because they're a good, good organization, but some people just say, oh, well, I want to do AARP, but when you really, Cynthia, you tell them what the advantages and disadvantages, they may change their mind.
that's right.
As far as with the Medicare supplement plans, you look at what's really different in here with those is, you could have ABC carrier and DEF carrier. Once you look at the plans, there are 10 standardized plans. So what you look at is which plan do you want? And what you're doing is, as you examine the plans, you're giving away something, right? So certain coverages you don't want, or maybe you do want. And because of that, that'll give you the price. But what changes once you identify which plan you want, it's a matter of finding, let's say you want plan G. So you look for whoever is the most inexpensive G that's available in your area. It's that simple with Medicare supplement plans.
Because they're all the same across the board with every single company. So you're really at that point, like he's saying, you're just, you find the plan you want, and now you're just gonna shop the company and see who's gonna give it to you at the best price, because they're all the same.
And can you do that?
I can do that.
I can do
It's on
that.
And when you call your doctor, or a new doctor, it's so interesting. Before they even say, hello, Anita Finley, or where do you live? Do you have insurance? They always want to
Absolutely.
ask about the insurance first.
Absolutely. And what about when they start telling you what insurance you should have? They start telling you, go with this company because it's good
Oh,
for them.
really?
Absolutely.
Really?
They
That's
ask you for
because
insurance.
they're doctors with that company, right?
Absolutely. Because some carriers pay different ways, so they fall in love with a certain carrier, they want you to have that. But what about all your other situations, right? So it might not be the right choice what the doctor wants you to have.
And they're allowed to do that?
They're just sharing opinions, I guess.
I
If it's
see.
the right opinion, I don't know, it's a whole other story, right?
And actually, Cynthia, you've been doing this for, I think you said 12 years. Am I right?
15.
15, oh my goodness. And how did you find her, Joe? You were clever. I bet when you first started talking to her, you knew immediately that she was going to be perfect for this.
Well, I don't have to say not too much, Anita, you know that, from speaking to her so many times. I have to tell you, what's really good about with Cynthia is she does her diligence, she's caring, she really takes pride in what she does, and that's what makes her very successful. If I could duplicate her, I would, but I can't. She's one of one, I guess you say, right? But she's good at what she does. We're very blessed to have her.
Thank you.
Yeah.
Thank you both.
Yeah, I feel the same way. Let's give your number again. It's 954-802-0738. And one thing that we didn't talk about, but I actually attended online Joe Battiglio's wealth and health seminar. And I encourage people to do that.
Yes.
It was so good, Joe. And so how can people find out when they can get on?
So what we'll be doing now, we're gonna have a predetermined schedule coming up, especially during AEP season, because it's important for people to know, again, that total approach that we always talk about. We want to have that total approach. So, we have a full staff to help people. We're also a retirement advisory firm, so we have that also. And the reason why we did that is because, again, the total approach. It's not just about Medicare, it's about everything else out there. And, we notice there's a lot of companies out there that offer Medicare. You call up certain agencies and they just put them into one plan because they're comfortable with that. That's not right. And that's not what we always did, and we don't do that. So we put them on the right plan, and then we noticed, people, they're retiring, they don't know where to turn. So a lot of folks we help who are retiring right now, and a lot of people, some do retire at 65, but the majority wait a little longer. But now they're retiring, the HR directors in a company said, I don't know what to do, call somebody. So we have so many relationships across the country with HR directors, and now we have a predetermined schedule that we'll share with you, and if we can post it, it'd be wonderful. But throughout AEP season, bi-weekly, we will have those financial webinars going on to show people things they should think about. Just as important as Medicare is, so is your retirement plan, and that's what we can help them with also.
Well, your company is unique, I must say that. I've been dealing with a lot of companies, and you are right. A lot of them specialize in one particular insurance.
Yes.
And they'll say that if it isn't right, they'll refer you, but they try to really push you in that because that's their company.
Yes, yes. What about those TV commercials, Anita? What about those TV commercials, right? With those sports stars or celebrities talking about all these different things. You go crazy with all of it, right? We find it very amusing. And when we talk to the consumers, we say, have you seen one of those commercials? And they say, yeah. Well, listen, you can contact us. You try calling that number again, you'll never get the same number. Right? When you call us, we answer our phone and we're here to help you. So
Exactly.
It's very amusing.
And they're not going to get them on the phone, are they?
Never.
No.
That's right.
Well, that's what TV and that's what they do. But I think people are getting smarter. I think what happens sometimes, because that's when we get back to this October, November, December. What dates are the days when you can really get into a new HMO advantage?
October 15th through December 7th, and that's going to be for the coming year, 2022.
Okay, those are very important dates for people to start looking at things and making a decision. And once they make that decision, they're pretty much hooked in for the year, aren't they?
Oh, I don't think so.
Not necessarily.
Oh,
There's
no.
another
Okay.
enrollment period called OEP, and that runs from January 1st through the end of March. And they have one time to make a change if, for every bit, they didn't talk to Joe and I, and somebody put them in the wrong plan. You can go ahead and you do have one time to change. So they're not necessarily locked in.
And it has to be like to like. So Medicare Advantage to Medicare Advantage, Medicare, it has to be the same thing. Or you can go back to original Medicare and a standalone Part D. But that doesn't make sense because you leave yourself wide open for cost in doctors and hospitals. So that's not wise to do that. Right. So again, that ends on March 31st. But then again, it doesn't stop from there. There's other times you can change again. So again, these folks out there don't know what they can do. So there's special election periods out there too. So are you familiar with special election periods?
No.
So that's the sentiment we get from everybody we talk to. So literally special election periods, like for example, if you got a 5-star plan, there are certain plans out there, especially in the state of Florida, that are 5-star plans. And they get that from Medicare because of the way they take care of their beneficiaries, their enrollees. They're spot on with everything they're supposed to do. So they get a 5-star rating. And because of that, folks can enroll into those anytime during the year.
All year round.
Yeah. But we've never had people leaving us because we put them in the right plan
To
in
begin
the
with.
beginning. There you go.
Yes, I have heard of 5-star, so that's what you're referring to, that once you
Yes.
get into that, well, that must be very hard to do because it must make a lot of them jealous that don't get that.
Well, the idea is a 5-star plan is available to anybody. So it doesn't mean you have to have special requirements to get a 5-star plan. That's available to anybody, right? But the idea is that if you look at plans, once you choose a plan, was it really the right choice? So how does a consumer know? I mean, you're sharing information in the videos, and we hope people are watching it, but a lot of times they're seeing commercials, or their friends tell them, why'd you go on that? You should be on this one. Not everything is good for everybody. You have to look at the right plan. And that's so important. So, during the course of the year, you don't want to make that mistake, what you did. So we want to do it right in the beginning. And that's what we're able to do, especially during the AP season. It's very easy when you find the right folks.
Well, I also applaud the government for providing the Medicare HMOs, because just think about that. I mean, people here in the United States now get to have a lot of health care with very little money if they're over 65. I mean, is it over 62 or 65?
65.
What?
65.
65, right? 62 Social Security. Excuse me, that's right. I got mixed up. But think about it. Here's a person. I don't know how many years ago this didn't happen, but now they do get a lot of health care for it, and I'm really happy that that's happening. And the only thing is, as you've all been saying, as long as you make the right choice, because I'm sure if someone's been suffering with certain diseases, they'll need to go to a different kind of an HMO, and knowing that certain doctors are the very best in the county for that, right?
Yeah, we've spoken before about the chronic special needs
Yes.
plans. And that's also an SEP where they can enroll throughout the year. And those plans are specific to their specific illnesses, whether it's diabetes or heart disease or what have you. There are some plans that cover those as well. And the medicines sometimes are a little bit cheaper, stuff like that. So those plans are really good too, and that is all year as well.
And also, you've talked about this before about the doctors. I think, how do they find a list of the doctors in each HMO? Do you provide that, or are they provided, like, what are all your doctors who are cardiologists? And will they provide that?
Yes, so if all your doctors, so go a little bit more about that. So when you say all your doctors are cardiologists. So again, you're gonna look you can do it online, or you do it through us, of course, but there are provider books that go in there. The provider books are now online where you can search. When you look at a senior, when they try to look at a health plan, right? This is the way I share with them. This is all you have to do, Anita. You're gonna call up all the insurance companies in your given area. You're gonna request a provider book, request a formulary book, request a summary of benefits. So maybe it might be 30 or 40 different plans out there. Put them on your kitchen table, right? You open them all up, get a nice spreadsheet, start writing everything nice and neat, right? Make sure it's legible, make it nice and neat, and start comparing all the plans. Then call up the carriers to enroll and ask some questions. It's just that easy. It's daunting.
No, forget it. No, we're gonna call Cynthia. Forget that.
There
I
you go.
got
She's
that.
here to help you.
And if we run out of time, let me give your phone number again. We'll have to do this next time. 954-802-0738. Listen, this has been just so wonderful. I'm so glad you were on. You surprised me today. I'm so
I'm
happy
gonna
to
do that
see
more
you in
often.
person.
Anita. I'm gonna surprise you a lot more, I promise.
Oh, okay. That's right. I'm gonna come. We're gonna have lunch, exactly.
Absolutely, absolutely.
Thank you very much for taking your time. I always learn so much. I think I know a lot, but I never know it all. And good luck, both of you.
Thank you so much, Anita. We'll talk to you soon.
Yes.
Bye, guys.
Bye, everybody. We'll be back with another show right after this.